The feet, very important part of the body. Most of us have two of them. And yet, in Western cultures in particular, it can be seen as one of the most neglected parts of the body. This is a very popular thing to say, but there are perhaps many reasons for this. For example, from an anatomical perspective, it can be seen as one of the most distal body parts from what we might see as the command center of our body, in Western cultures at least, which is the big old brain. And of course, the cultural factors of the environment around us. We work with a lot of flat surfaces when working through cities, when walking through towns, and also the types of footwear and things that are chosen in modern societies for different things. There is much that you can read into with this with regards to statistics and different reasons. However, that's not of my main concern. Our main concern is moving. So how can we help bring these feet essentially back to life? It's important to think, first of all, that in most cases when we're walking bipedally, which most people do, it's our direct connection to the ground, so that anything else, any other type of movement in your body is going to be subject to the potential or the restrictions of the feet. So this is just quite a basic reason from a physical practice perspective to invest in foot care. Throughout these few videos, we'll be taking two different ideas with regards to approaching movement of the feet. And one is the idea of moving the feet. The other idea is the foot being moved. Moving and being moved. This is a perspective which can actually become quite abstract. For example, if someone is performing in front of me, they're singing or they're dancing, they are moving, and me as a person in the audience is being moved. This is kind of this dichotomy there between moving and being moved. So with regards to the feet or the body, you can think of things such as body work, as massage, as an action of being moved. For example, a chiropractor moves you and you are actually being moved. You are not necessarily instigating that movement. This is very, very useful for helping mobilize areas. For example, if you cannot move an area because there is no ability to move it because there's physiological restriction. In the fascia, in the connective tissue, there's certain issues that develop there over time, which has effectively started to calcify that area and just turn it into a big old concrete block. The foot can be and should be very, very mobile, very, very pliable, very, very supple. However, in order to get there, these interventive measures such as self-massage and working with the feet are necessary. And this would be the perspective of being moved. From there, once there is some potential for the feet to be moved, we then look at actually moving. Moving then requires the consistent practice in order to build a neural drive in that foot, which essentially means a kind of, a mind-muscle connection in a very rudimentary form. But what we're actually doing is creating an action with the foot, or even visualizing a certain action happening, and then building a motor map in our brain. This does take time. It is actually a physiological phenomenon. It will take time for you to be able to wiggle the big toe. If you've seen this film, Kill Bill 1, really, really great film. But in any case, at some point she wakes up early on in the film from a coma from some time, and she's unable to walk. She sits in the back of the pussy wagon, her car, and then she puts the feet in front of her and she quite simply says to herself, "Wiggle your big toe. Wiggle your big toe." Nothing happens. After about an hour or something, she just notices a twitch from the big toe. Tarantino fast forwards the film and you see she's been in the car for some hours, and then eventually she's able to walk. This is the perspective that we're looking at, and we will be using the following tools in order to get there. We start with manual manipulation of the feet. Now this particular routine is taken directly from Kit Lowlin, who has a fantastic video on this full foot routine. I will link it in the video description. So we're going to start just by bringing the foot that we're working on up onto the other leg, and we take the foot into the hand. And the first thing that we're going to do is just soften up the foot a little bit with just some manual manipulation. Very, very simple. Some specific points that I'm targeting. I'm looking at the arch in here, of course, just finding any tender points. I'm working underneath the ball here to the front. I will also work underneath the toes and the top of the foot, the outside of the foot here, just warming up the area, also the heel and a bit of the ankle as well. I'm essentially just showing this foot some love. I'm just giving it a bit of a rub. I'll just take at least a minute going through this, really grabbing the foot. In some cases, this can be almost meeting your foot perhaps for the first time. Maybe you've never really touched your foot because you think it's gross and disgusting. Or just consider a foot that looks like a cinder block. That is also pretty gross and disgusting. So what I'm going to work with now is just moving into the toes. I just get familiar with the toes. I can work underneath here as well, grabbing the toes. What I'm doing is essentially just peeling the foot apart slightly, as well as getting to know my own foot. In some cultures, this is absolutely fine to do at a dinner table. I can tell you that from experience. So there's nothing wrong with getting familiar with your foot. Once you feel you've softened it and warmed it slightly, start then just with some light twisting and moving. We're just working lightly at the moment. Some bending of the toes all together, just pushing them slightly back, maybe closing them underneath your hand as well. Just like this, and I'm not really pulling and stretching, I'm just feeling what's there, what's not there, if there's any painful parts in the foot. When you start moving with the toes, you might find that broken toe that happened from when you were playing football 10 years ago and someone stood on your foot. These things are all still in there, especially if the foot has been neglected. Now, once you've worked through the foot here, you've done a little bit of the toes at the front all together. Now just bring some attention to the top of the foot and just start peeling apart the bone structure of the foot. Just feeling in between there again if there's any painful points. And we're not focusing too much on painful points at the moment. This is just registering what's there and what isn't there. And when you're working here like this with the fingers through the bones, you can also on the back here at the same time be working through the arch of the foot. And we've got to have the outside, the inside of the arch here, and then also working more towards the medial foot, towards the inside. Of course, on the knife edge of the foot as well, the heel. The Achilles can also be worked over in a cross friction type manner. So on the other side here, I'm just working with the thumb back and forth, just going up, just going down, a little bit into the soleus, but mostly orienting it around the foot. Now that the foot's prepared, the first thing we're going to do is we're going to force a foot spread. Now the foot spread, or the toe spread, is essentially an ability to actively open the toes apart here. And we want to have this availability on both feet. Now, if this is completely beyond you at the moment, that's fantastic, because it means you're going to see great progress as you keep working along. And we're going to use this idea as a model. The model of being able to spread your toes is an idea that we'll work towards throughout the practice. So, under the perspective of being moved, if you're unable to move in that position at the moment, we will be moved by using the fingers. You're going to take your small toe and you're going to take your small finger and you're going to put that small finger right into there, here. Now, this might feel a little bit tight. Good. Get it in there even deeper. As deep as your finger will go in between that toe there. Get that in there. Once that's in there, you take the next one. Again, you might have to readjust the small one, but get the next one in there. There it is. It's in there. Move around a little bit. Then the next one. And now it might start to feel tight. Now it might start to feel like you've got some pinching and things happening as well. Good. Open lastly the big toe. Squeeze that finger in there and get it in there. And now at the moment, you might feel like, wow, this really kind of almost hurts. If this is the case, keep practicing. Start just with the first flange of the fingers here and bring that as deep, pulling down as deep as you can. And then just work that in there for a moment. Try to keep it in there until sensations of pain or tightness start to dissipate slightly. Ultimately, start wiggling them in even deeper to here. This is where we would want to go with this frame. It might not be available to you right at the beginning, but as you progress over time, you want to go deeper, deeper, until you can completely close, as if I'm holding my hands like this. It's going to go completely in there. And now I have a good grasp of my foot. From here, once I am deeper, now I can start to really work with the toes, with the benefit of having these fingers to then massage into the knuckles of the toes as well. And again, just start to peel apart that connective tissue and just to mobilize manually that connective tissue in the toes. In here as well, we're going to work with some twisting. Now this is quite strenuous. The foot is quite strong unless you have some existing injury, in which do work, but just be mindful of where any pain is. Just start to twist in there and twist back. If you start losing grip of the toes, just readjust your grip on the toes, because this is a priority at the moment. Start working in there. You can pull the toes backwards and pull them forwards. Just working around in all directions, spending at least a couple of minutes on here, if not up to 5 minutes on each foot. Working, twisting, and with this, it's like I'm wringing the foot out. Just getting all the range of motion that's available in there. In the first instance, you might feel like I cannot be this thorough with my foot. It will develop over time. So now that we've worked that on the foot here, we're going to go more specifically into the idea of spreading the toes. Be mindful that if you're suffering from dry skin, for example, around the feet, this is also something that this routine is dealing with, is building the suppleness of the skin. If you have very, very hard skin in your feet, this is also a sign that the foot has not been used so much in its full pliable form. Of course, if you work with dance or something like this, or capoeira, and you have very hard calluses on your heels, this is something a bit different. This is a protective mechanism. But if the skin is very hard due to underuse, you may have to place just some types of oil on the skin, some cream, in order to ensure that we're not splitting the skin, which can be very, very painful. Another idea, if you suffer from particularly hard skin, is to put a very heavy moisturizer on your foot, even like a type of Vaseline, put it all over the foot, put the foot inside a sock and sleep overnight, and you'll notice the difference in the morning. So taking into account with the skin, what we're going to do now is we're going to take each of the toes. We'll start here by the small toes. I take one toe and I pull it up. I take the other toe and I pull it down. And I'm really just working here with spreading those toes up and down. And then once I've done that a little bit, then I go the other side. The toe that was up goes down, the toe that was down goes up. And I just work a few times, pulling that up, down. I'm showing you for the camera here, but of course I would just work like this. Hold it for a few moments, up, down, Go to the next one, still including the one before. Moving up, moving down. Go all the way through it. Notice any restrictions, any feelings of pain. Work around it, but do recognize it. The next one, going up, down, up, down. The next one, working through, down, up, down. Working through that full range. Once you've worked through that, we're going to look towards splaying the toes apart with the hands. And again, be mindful of the skin, but we are ultimately looking towards being able to achieve this 90-degree angle almost with every single toe. So I'll be working through that, just there, again, working towards this 90-degree angle between the toes, being mindful of the skin, working through, again, at least another minute or two, working through these as so. Pulling the toe apart. Any specific restrictions, working to those ones a little bit deeper. You can even go back through them, that's no problem. And then we've worked with mobilizing for spreading of the toes. Now we're going to attend to each toe individually. And the way we're going to do this is we're going to start off by quite simply pressing through the toes to check where there is or where there are physical limitations and restrictions, and actually working manually to start developing those into movement. So for example, here with the big toe, I will just check, can I bend it backwards? Can I bend it forwards? Is there any pain in there? I'll just check. Is it available? Massage a bit through the toe. Nope, that one's fine. I'll go to the next one. This is a toe that I actually broke, and I can feel that there's some hard cartilage here that even after years, I didn't treat it so immediately. There's hard cartilage, and when I press it, it hurts quite a bit, but I can actually break up that cartilage slightly. And of course, afterwards, it may even feel quite painful because it will be slightly inflamed. But these kind of calciferous tissues are things that we're trying to break through in order to bring that foot back into movement. Again, I check the extension and the flexion. If it's limited in one area, I'll just really push in there and just see what's available. And again, working through the other toe, just massaging through, working the way down. And then the little toe as well in particular, if you find that it doesn't really bend at the joint that it has, you can even just hold and then forcefully extending or flexing it with the hand. Be mindful, but be thorough. So now that we've gone through each of the toes, we're now going to be a bit more strenuous by actually wringing the toes in each direction and pulling them. So starting with the big toe here, again, I'm literally, I'm riding that thing like a ring, 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 like a motorbike. I take it, I twist it one way, I twist it the other way, I pull it, and again, being quite strenuous. This is a nice sound that you can play with. Backwards, forwards. I take the next toe, the small toe, I twist it, knack. I twist it back, no more knacks. I go, oh, there's a knack. Pull that through. The next one, knack. Any more knacks? And I can work through this quite thoroughly. And the next toe, knack, knack. Working through that one there. Working through here, knack, knack. That's worked through the toes. I would then just give a little bit of a massage to the foot again, just half a minute maybe. Just bringing it back a bit into life. And then from here, we're really going to go into the perspective of the pliability of the foot to supinate and pronate as well, and which is something that can't be forgotten. The foot is actually multi-planar and it has multi-functions. It's not just a case that it extends and it flexes and we just roll over it. It has, of course, pronation and supination. It should be able to supinate pronate, and this actually happens more in the middle area here with those bones that are able essentially to shape themselves around any surface that you place them on. But of course the problem is if that surface is consistently flat, it does not have the potential to express that range, and now we have to move it into that range. So from here, quite simply, I'm going to take the whole foot in any way that it feels like I can best wring the entire foot. Now, just as we were wringing the toes, now we're going to wring this whole foot. Again, be mindful if you're suffering from any injuries, or especially around the ankle, but at the same time, do be thorough. What you can do if you have any types of instability in the ankle at this current time is keep a little bit of tension in the ankle to prevent too much passive stretching. But if the ankle's good, you go for it. You grab that foot and you twist it. Take it from the back, you twist it around. I'm working, just wringing it through. I come back around again. Of course, this is working with the supination idea of the foot. I'm turning outwards here. Really twisting it outwards. And what you can even do here, if there's limited range or you can feel tension but not so much pain, is actually a contract and relax. So I can twist the foot into the end, and then I can actively, for 5 seconds or so, try to actively pronate the foot and actively twist it the other way. So from here, I'm now going to hold and pull against the twisting for 5 seconds. So I'm pulling 5, 4, 3, 2, 1, and then I release it slightly. I go in for it again, I hold it, 5, 4, 3, 2, 1, I release it, and I can work with this 2 or 3 times if I feel that's necessary. Of course then, we work into the pronation of the foot. So, pronating inwards. So, I'm going to twist again inwards this way. I'm going to grab the toes. Now that we've got the foot here, we're actually working with the outside and pulling it inwards. So those toes went from being worked out this way, and now they're working in this way. I take the foot, I wring it back. Again, in any way that it kind of feels like I can fulfill this idea of supinating the foot inwards. Make sure you're not closing the toes on this one, because again, that would be working the other way. Open them outwards. And again, work with the same idea as before, the wringing, and I can also do the contract, relax, but of course now I'm working the other way. 5, 4, 3, 2, 1, and then I relax the foot. And again, I'm pulling backwards, so I'm going to try and rotate my foot forwards to contract for 5, 4, 3, 2, 1, and then I release it. I'm just working through those feet there. Good. Now, working briefly into the Achilles, we're just going to basically use 2 types of massage, and it's both going to be utilizing mainly the fist here, the fist and the knuckles. The first massage is going to be quite simple. I'm working along the back here, and I'm just going to catch the skin. I'm going to work probably around this portion here, the lower soleus and with the Achilles, catching the tendon in between my knuckles here, shaping my knuckles around it somewhat, and I'm just going to catch. I'm just going to work up like that, and then I'll slightly change the angle of the knuckles, for example, so a knuckle can go more into this side. So I can work more into this side of the tendon. I'm just kind of imagining that I'm pulling up through the fascia and straightening it out. I can even then work to the other side of the Achilles. Working through there. I can go in a bit deeper, down towards the insertion here, down behind the heel. And then I can also just quite lightly brush back and forth and work with this cross-frictional type massage. Now you can work this in both ways. You can work it with the the foot in more dorsiflexion, so I'm actively pulling here. Or I can also completely relax, explore both of them and everything in between. I'm just brushing there up and down, again using these knuckles to brush across it. I can change the angle slightly, and then again working up and down, and finishing off maybe with just some rubbing. Again, keeping the pliability of the Achilles heel. The last thing we'll look at is some loaded stretching for the foot and for the toe. Now, we're going to be sitting backwards on the foot or towards the foot, so you can just pull the calf muscle here out of the way so that it reduces the load on the knee, and the other foot can come to the front here. Now, for some people in this position already, just for example, we're just here, like this, the foot is out to the side. This might be causing quite a stretch. If you're feeling quite a deep stretch in this position, then you can pretty much not think about anything else and just stick with this. But in order to make this a bit more of a productive context, what you can do, and what I'd like you to do, is to push the foot, or even extending the whole leg into the floor for 5 seconds. Now I'm pushing down, 4, 3, 2, 1, and then I relax, and I just sit back a bit more. The idea is I'm trying to sit back onto this hip so that I can almost bring myself towards kind of straight up here. This is a more loaded position as opposed to leaning to the side and bringing the weight off. So you're going to be working with some contract, relax, pressing until you can slightly load a little bit more in this side. Now, when you can load more in this side and you can feel your weight even through the hips, what you can do now is just lean back slightly and feel this knee slightly raise off the floor. Now, at this time, you should start to feel a stretch down the anterior side of the foot here. Now, again, what we're going to do with that is actively try to dorsiflex, so actively try to press that foot into the ground. And again, I'm going to hold for 5 seconds, 4, 3, 2, 1, and then I release. I might find myself with a bit more range. I bring it again into the ground. I'm pressing, 4, 3, 2, 1, and release. And again, my load is still down into this hip as well. I go another time, 4, 3, 2, 1, and release. And you can repeat that for anywhere between 3 and up to 6 times for 4 to 5 second holds. Now, what we can do to then access the toes is slightly shift the weight from this hip more to the side and allow this knee to come up higher until you now feel a stretch coming more through the toes. And then when you start to feel this stretch in the toes, you should feel it shift. Again, use the contract, relax. 4, 3, 2, 1, and then release. You find a bit more range, maybe working back a bit higher, pressing, 3, 2, 1, and then release. If you happen to get an extreme cramp in this position, one thing you can quite simply do is then bring the foot to the front here and just bring your weight slightly forward, relaxing the foot, stretching out the Achilles, and this will bring some immediate relief. We will also use this position as well, and it can be used for accessing some loaded dorsiflexion just with your body weight. So once you've worked with this part of the foot and then worked into the toes, you can bring the foot forward here. And again, you can just start to load slightly and just working into the ankle. Do work into this next frame, which is essentially starting from a kneeling position. I bring myself up and I sit myself onto the heel. Now, quite simply, I can adjust the load by bringing myself more upright, or for example, for even shifting this knee more backwards or more forwards to increase the load. So shifting the knee backwards is of course going to increase the load on that, increase the extension there. But also likewise moving forward can increase the actual angle of the stretch. There's two different textures you can work with. Again, from this position, I essentially want to get these toes all flush along the ball of the foot, so the ball of the foot has complete access to the ground. Again, I don't want to be avoiding the small toes. It's anatomy dependent, so just check what is appropriate for you. And then when you have this position, you're going to work here, again, just stretching there, opening the toes. So imagine, I'm closing, the toes, pressing them into the ground, or opening them into the ground. Again, 4, 3, 2, 1, and then relax. And I'm just pressing through again, and then relaxing the foot. 4 to 6 times, and once upon finishing that, again, you can just massage the foot slightly as you did in the beginning, shake the foot out, and that's your mobilization, manual mobilization for the foot. If you feel like you are prepared and ready to take more of a stretch for the toes, is a full toe closing in which you come over the top here, and then I first take the first knuckle of the big toe, that's this kind of first bend here, and I try to place it flat to the ground. Now this is enough, placing it flat to the ground. And I put that there, and then I can work, if required, into the next knuckle, and again managing my body weight over the top, and once again I can extend 1, 2, 3, 4, 5, and then relax. I can find a bit more range and I can press again, 2, 3, 4, 5, and relax. And then what I will ultimately look for is, of course, I don't just want to affect the big toe, I want to also affect the other toes here. So it depends on the anatomy of your foot, but I'm actually at a slight angle here as I'm opening those toes into the ground, because I eventually want to have the mobility through all of them. And the last part, if it's available, is then to close the foot off almost entirely and really wrap those toes underneath, and an opening, again using the contract relax, 3 to 6 times however, and then release.